Hello, everyone. Good morning, and welcome to another AMA session with Dr. Ben. I'm Dr. Ben Behnam, founder of Happy Ed. So sorry I have to wear this sweater here because at Happy Ed headquarters, they really keep this room really cold, so no one falls asleep. So it's been freezing. Well, guys, welcome. I know it's been a while that we had our AMA session. Everybody was out and about for the holidays. So welcome back from holidays. Welcome. So today's topic is the super capsule by Happy Ed. So the way it works, we'll go through one topic and then we're gonna go through all the questions as we usually do. So super capsule was developed by us. It is the first of its kind where we've actually been able to combine three different ingredients all in one capsule, making it easier to take the medication and streamlining the entire hair loss process. So one, it has oral finasteride. As you know, oral finasteride is the number one medication for hair loss in the US and probably around the world. And oral finasteride is a testosterone blocker. It blocks the DHT, and by itself it works pretty well. But our idea was to kind of combine multiple different things together. So in addition to the oral finasteride, which is 1 milligram in the capsule, we also have oral minoxidil. Oral minoxidil has gained quite a lot of popularity in the past 4 months, ever since the New York Times article. It's a blood vessel dilator, which means it increases blood flow to the scalp. And by doing so, it washes away the DHT, which is responsible for causing the hair loss, and also brings more nutrients and oxygen to your scalp, which, it basically kind of feeding, food to your hair. And combining the two together allows us to try to treat hair loss at multiple different angles from multiple different sources. So we know that your hair loss is not purely due to THC, there are other factors. So by combining these two different ingredients together, basically allows us to combat the hair loss from its different sources. Also, we have vitamin D in the product because a lot of guys honestly lack vitamin D. So the super capsule combines finasteride 1 milligram, minoxidil 1.25, and also vitamin D all together, streamlining your process. You take one capsule once a day and you're done, and you have great hair. So that's the super capsule. We're pretty excited about it. We just launched it. Again, we're the first company in the entire US basically that has this compounded formula. So, can women take the super capsule, and is the dosing different for women? So, if you're above age 50, you could take it. Um, yes, if you're above age 50, you would take it. I was just trying to think if we have a specific woman version. We don't, but we're thinking about coming out with a specific woman version, having spironolactone, possible minoxidil combined together. It's in the works, guys. You can't. So finasteride, we do not dispense the finasteride to females below age 50 because the category X. So God forbid if you get pregnant on it, bad things happen. So if you're below age 50, females cannot take oral finasteride. There are some doctors that prescribe it, but we made a company policy early on that we just don't do it. It's for patient safety. But if you're above age 50, you could do it. Again, we are trying to come up with like a female version of the super capsule. It's currently in the works. How do you transition from the topical Happy solution to oral super capsule? So that's a great question. So if you look at a lot of our internal studies, so let's say you've been on oral finasteride for 10 years. Eventually, you're going to plateau on it. I mean, that's how things work. So instead of coming off the oral finasteride, but we realize if you add the second option, that means like doing topical Happy Ed, you're going to get much better results. So the idea is always not to replace one with another, as long as you don't have any side effects, but honestly add one to the other and you're going to see better results. So if you're already on Happy Head, it's probably, unless you're having side effects from it, it's probably better to add the super capsule and you're going to see better results. But now, if you just don't want to do the topical, that's a different story. Then we'll just switch over to the super capsule. And the way you transition is that you just want to taper off topical and slowly basically taper on the super capsule. So you go from doing the topical every day to like 5 days a week and then 3 days a week. So you're slowly every week coming down a little bit and you're adding up on the super capsule. Oral minoxidil or minoxidil? Which one do you recommend? Minoxidil. if a woman can take this capsule, what are the possible negative side effects? So finasteride is actually a pretty safe medication. There are two issues with finasteride. Oral finasteride could have risk of sexual side effects, mainly particularly in males, and the risk is 2 to 4%. So if you're a female taking it, really there's no risk of sexual side effects. Number two, finasteride could have a very, very, very low risk of depression and anxiety, which is very rare. It was never, honest, it was not reported for many, many years after it was distributed in the US, and it's only been the past 5 years that it's kind of come about. But that's something you should know, but it's very rare. If you have a history of breast cancer, I do not recommend you take oral finasteride. Um, there's also vitamin D, which there's really no negative side effects from that. There's also minoxidil. Minoxidil, the oral minoxidil blood pressure medication. So side effects typically includes lowering your blood pressure, that means feeling dizzy or lightheaded. So if you're like a petite female, this is one thing that I would probably be a little bit careful about. So I would take the pill at night before you go to bed, just to make sure you don't get dizzy or lightheaded. Other rare side effects from minoxidil includes headaches, heart palpitations, chest pains, and shortness of breath. But for the most part, those are rare. We have a lot of female patients on oral minoxidil, unhappy, and also my own personal office. We have a lot of females on oral minoxidil, like a lot. The only thing about oral minoxidil is that if you are of kind of Middle Eastern like origin, like ethnicity, like a little bit darker skin, sometimes the minoxidil could cause a little hair growth throughout the body. So something you should kind of be aware of. At that dose, honestly, it's pretty rare. Would adding DMSO to my happiness solution be a good idea to increase absorption? No, I would not do it. DMS was actually quite irritating, and it could cause quite a lot of peeling off. It's used in other products, but we have not decided to use it in a happy head, especially around the face and eyes. So please do not add DMSO to your product. Can you make a version of topical finasteride, dutasteride, minoxidil without the hydrocortisone? I'm trying to look at Eric. Eric, we don't have that version? The kitchen sink formula without hydrocortisone? Sorry, we have like literally over 50, 40, 50 different versions. I'm trying to think. I think the kitchen sink is only one formula. Um, yeah, so, yeah, and so that one is just one formula. It's honestly very difficult. We might have in the future, but we don't have it right now. You could send us an email at help@happyhead.com and we'll get back to you. But I don't think we have that at the moment. Sorry about that. How does the finasteride and SuperCapsule compare to topical finasteride? So this goes back. What was that?
We have one that has dutasteride, finasteride, and minoxidil only.
Oh, we do have one. Oh, so CF. So we do have one. So apparently we do have a kitchen sink formula without hydrocortisone. Thank you for checking, Eric. Sorry, we have so many formulas that sometimes we don't even know unless we go back and check. So we do have that one. So why don't you email help@happyhead and say I want the kitchen sink without the hydrocortisone, and they should be able to get the approval and send it to you. How does the finasteride of SuperCapsule compare to topical finasteride? Well, this goes back to the original reasons why we started Happyhead. So originally, the reason why we did Happyhead was because oral finasteride does carry risk of sexual side effects, which is 2 to 4%. Happyhead is topical finasteride with basically potentially having way lower risk because you're not taking it orally. The way that we have structured the super capsule is that when you start the pill and directions are written on it, you actually don't take one tablet every day, one capsule every day. So in order to minimize some of the sexual side effects, we actually have we have patients taper up slowly, which means week 1, you take one capsule. Week 2, you take 2 capsules. That means like you do a Monday, Friday. Week 3, you do a Monday, Wednesday, Friday. So you're going up slowly. And by slowly titrating the oral finasteride, actually majority of patients really tolerate really well. Your body does not get a shock, and the risk of sexual side effects go down significantly. Now, if you're already using the Happy Head formula, your body has already gotten used to the topical finasteride, so the risk of sexual side effects from the finasteride and the super capsule is quite low. But again, if you're not using a topical Happy Head, I recommend titrating up very slowly, and it already says that in the instructions. How long should I wait to wash my hair after using Happy Head? You could just wait 1 hour and you could wash it off. Can the topical solution help with hair loss on the sides of the head? Yes, you could really apply it everywhere, and it should, in theory, really help you everywhere. Can you take in combination? Can you do the super capsule in combination with topical? Yes, you can. In fact, if you do it, that is the best treatment. So the new paradigm, or the new basically protocol that we have kind of established in our own personal clinic in LA, and also it's kind of kind of coming to Happy Head, is that some patients are going on topical finasteride with minoxidil and oral finasteride with oral minoxidil. Now, if you do that, you're pretty much doing everything. There's nothing else that you could do. That is like the best of the best. So if you're already doing the topical Happy Head, you could certainly add the oral super capsule to it, and you should be golden. I mean, there's nothing else you could do. Since this goes directly into the bloodstream, has there been any research on how oral pills can affect any other organs? Well, yes. I mean, you have to realize that the oral medications have been around for many, many, many years. And in fact, this is how all the medications for hair loss have been taken for, honestly, over a decade to 2 decades. So the topical Happy Head is relatively new because that's the one that it goes into your bloodstream less. So we know as a fact that when you take things orally, it's going to affect other organs. And this is why we have patients titrate up in order to minimize some of those side effects. So titrate up. So what I mean is that, so week 1, do it on a Monday. Take 1 capsule on Monday. Week 2, do twice a week, which means do a Monday and Friday. Week 3, do 3 times a week, Monday, Wednesday, Friday. So every week you're adding 1 additional day until you're doing it basically every day. Will the super capsule work faster than the topical? Actually, I'm not sure. I mean, it's kind of hard to say. Um, One of the benefits of super capsule is that you're taking orally, but one of the benefits of topical is that you're literally applying it where you really need it. So I have some patients on topical that literally come back 4 months later and they're amazed by the results. So that's kind of hard to say. We typically say for every product, either oral or topical, you really want to give about 4 to 6 months to see the results. How long before I can expect to notice a significant difference at the top of my head and back of my head? Typically 4 to 6 months. Can my dutasteride be formulated to minimize side effects? Because I'm having side effects on the top with a topical dutasteride. So if you're having side effects with topical dutasteride, please reach back to us, and we will be more than happy to lower the dutasteride concentration for you. So by minimizing the concentration, hopefully you're gonna have less side effects. Also, don't do it twice a day. You should probably do it once a day, every other day, and see if that helps as well. So please reach out to us at Help at Happy Head and say you're having sexual side effects. We will lower the dose and send you another bottle. Is the dutasteride super capsule equal to dutasteride zero point 0.3 topically? Why is this dutasteride capsule 0.5 while the finasteride is 1? Okay, so that's a great question. So this goes back to how these drugs have been originally distributed in the US. So in the US, finasteride for hair loss is typically 1 milligram, and dutasteride is 0.5. That is just how they've originally been marketed. That's how FDA approved them. So we're taking those pre-approved medications and putting them basically into the supercapsule formula. What if you take blood pressure medication? So if you're on the blood pressure medication, you have to ask your doctor because of the oral minoxidil, because that could lower your blood pressure as well. So just run it by your doctor. They're gonna be taking the minoxidil 1.25. Now, minoxidil 1.25 is a very, very low dose of blood pressure. Typically, to achieve good blood pressure control with oral minoxidil, you probably have to be between the 5 to 10 milligrams. So, but again, you should probably ask your doctor. How does Dumarola help in the process, and when can and I begin using after doing the starting the super capsule? So derma roller typically is recommended in conjunction with a topical Happy Head, but again, there's some patients that do it, without using any topical Happy Head on top of their skin. So we typically recommend the derma roller that's 0.25 depth. Again, you don't want to be very aggressive. So if you put topical Happy Head on, you're gently going to roll basically back and forth, and that's going to help stimulate increased blood flow. It's also going to make tiny holes in your scalp, so it's going to allow for better penetration of Happy Head. If you don't use it in conjunction with happy head, it would just wet your hair and gently derma roll. And you could obviously do that in conjunction with the super capsule.
Should you derma roll every day?
My recommendation is you should derma roll every day. Use the 0.25 and derma roll every day. Are there any contraindications to taking the super capsule? Well, with respect to minoxidil, if you are already on a blood pressure medication, you should ask your doctor. If you have heart failure, you should not use this medication. If you tend to have like really bad migraines, really bad headaches, you should probably avoid it because some patients could get headaches from it. Um, Obviously, don't use this product if you're pregnant. Um, with respect to the finasteride, again, if you have any history of sexual side effects from using any finasteride in the past, do not use the super capsule. Is minoxidil 1.25 and dutasteride equally as strong as minoxidil 8% topically? So you're talking about the super capsule. The super capsule, we have two versions. One version has finasteride with minoxidil, and the other one is dutasteride with minoxidil. So the question is as strong as taking minoxidil 8% topically. Again, it's hard to compare the two. And I mean, we've never done a comparison, so I just cannot tell you that exactly. Again, some patients do very well by applying things topical to the scalp, and some other patients need a little help. That's why we came up with the super capsule. I think it's just tough to say. Am I likely to experience more side effects compared to the topical, and are they reversible? So we know for sure that oral finasteride carries more risk of sexual side effects compared to topical finasteride. I mean, that we know that. But if you already been on topical finasteride, your risk of the side effects to oral finasteride are probably going to be minimal since your body has already gotten used to it. Also, if you titrate up slowly, like the way I've been talking about before, the risk of side effects from the finasteride is going to be low as well. With oral minoxidil, the risks are actually pretty minimal. Uh, I mean, if you're very petite, you could lower your blood pressure. Some patients could have heart palpitations, and some patients could get headaches. But for the most part, oral minoxidil is tolerated very well. If you have been on a topical finasteride and then topical dutasteride, and now want to switch over to oral, should they start with oral finasteride supercapsule or go straight to dutasteride supercapsule? So okay, actually, I'm gonna go back to what I said like at the beginning of my talk today. If you're already on topical dutasteride, instead of switching over, as long as you're not having any side effects, add on the oral medications because you will see better results when you do what's called sandwiching. When you're applying topical and oral together, you're gonna start better. You're gonna get better results. So if you're currently on the topical dutasteride, I would add the oral finasteride supercapsule and titrate up. At what level of hair loss does this solution work? So pretty much as long as you have some sort of hair, it's gonna work. Remember, any medication out there, topically, orally, oral finasteride, the super capsule, is going to work on your own existing hair. So, which means that the most ideal candidates are patients that when you look at the hair, you have thinning throughout the scalp. Now, if you're bald and there's no hair there, I mean, nothing's going to work. I mean, super capsule, topical, oral, nothing's going to work. But if you have hair there, then it should work. Dutasteride has a very long half-life, so why the twice the application for the topical? That's a great question. So we've actually seen that patient with the twice the application still do better. You're right. Dutasteride does have a very long half-life, but you have to realize there's also minoxidil in the mix, retinoic acid in the mix, and those have to be applied twice a day. Again, patients typically see better results with twice the application of topical dutasteride compared to once the application. I'm going on vacation for 2 weeks. Great, congratulations. Does it make a big difference if I stop using the drops for 2 weeks? It should not, honestly. I'm using the topical happy along with the Derminator too. Will this combo help with my hair loss and the frontal hair loss? Yes, it will. It will help you quite a bit. So please use it with the Derminator. I would recommend applying the topical happy on first and then doing the Derminator. So Derminator, for people that do not know what it is, it's just a derma roller. It's a form of derma roller. I have left over 5% minoxidil. Can I use that up in conjunction with Happy Head formula? I mean, you could. I don't think you really need to. The Happy Head formula already has 8% minoxidil, and my fear is that if you use it along with it, it may cause more irritation. Can I add oral minoxidil separately if the super capsule isn't showing results? So, yes, you could. So, the super capsules minoxidil concentration is 1.25 milligrams. If you look at the recent New York Times article, I think they were doing zero point 0.6. So, it's in less than what we were doing. So, we're double that dose. But there are some patients that need to be on a higher dose of oral minoxidil. So, let's say you're doing the super capsule. I would probably give it like 3 months, and if you see you're not seeing the results, you could probably add a separate oral minoxidil, the 2.5 milligram tablet. Just be careful that it doesn't plummet your blood pressure medication, your blood pressure, and if you're currently on blood pressure medication, please run it by your doctor. Can you explain the difference between oral finasteride and oral dutasteride? So they're both DHT blockers. So the way it works, that finasteride gets converted to, well, I'm sorry, the testosterone gets converted to DHT. There are two enzymes that do this. It's called 5-alpha reductase 1 and 5-alpha reductase 2. Finasteride inhibits one of those enzymes, whereas dutasteride inhibits both of those enzymes. So in clinical studies, oral dutasteride has been shown to be more effective than oral finasteride. But there is a but. There are some patients that, although dutasteride is more effective in clinical studies, there are some patients that may not respond to oral dutasteride. So it may not work for everyone. Thank you for answering. Does this also help grow new hair or just maintain excess hair? No, it could actually cause more hair growth, um, significant, much more hair growth. Uh, for oral minoxidil, the recommended dose is half a tablet a day. Is it safe to take the full 2.5 milligram tablet? Yes. You could take the full 2.5 milligram. It really depends. So with females, I typically like to keep it at half a tablet a day. For males, you could go up to 2.5 milligram tablet a day, as long as there's not any side effects on the half. So my recommendation would be is to take the pill and cut it to a quarter for the first 2 weeks. Then you're gonna cut it to a half for the second 2 weeks. And if you're female, you stop there. If you're male, then you could go up to a full tablet. Is it true that finasteride helps keep what you have while minoxidil causes new hair growth? Actually, that is not true, actually. Um, they could both maintain what you have and also cause more hair growth. Everyone responds differently. I don't know where that rumor came from. A lot of people ask me that. Well, these trims make my hair thicker as well. Uh, yes, that's the whole point. It should make your hair thicker. In fact, yesterday in my clinic, guys, we saw a patient who was on oral minoxidil and oral finasteride. I think, and literally in 6 months, he had amazing results. I should bring you the photos next week. You guys will really enjoy that photo. Should you take additional supplements? Which one? So obviously with the super capsule, it already has vitamin D. But again, I always recommend adding multivitamin to your diet. And happy we have an amazingly great multivitamin. Adding vitamin D. If you're female, add iron and also add collagen to your diet. The collagen I like is the Vital Proteins collagen. You could buy it on Whole Foods. Just 1 scoop a day in your tea or coffee or milk. It does really well. Can I use the super capsule while I'm using the water-based formula? I've been using it for 10 months. I'm also taking the hair supplements. Yes, you could use the super capsule along with the water-based formula as long as you don't have any side effects. Yes. So yesterday I saw a patient who was on basically our version of the super capsule, or minoxidil, or finasteride, and he was also doing the topical minoxidil with it, and he really had quite amazing results. In fact, to a point that he could not even believe um, the photos himself. Can I add SuperCapsule to the kitchen sink formula? Yes, you can. So that is the new trend that we're establishing. Basically, patients being on the topical finasteride, topical minoxidil, and also oral finasteride, oral minoxidil. Um, yeah, so that's the new trend that's basically emerging uh, out of LA. It's kind of going everywhere now. Copycatters are using it again, but it's all right. Can you explain how to use a derma roller? Do we have a derma roller here? Oh, there's one right there. Thank you. Okay, so here is our derma roller. So basically, this has 540 very tiny spikes. You can't really see it, but these metal spikes they come in different lengths. So the ones that we recommend is a 0.25, but you could get some that are like 2 millimeters, 2.5 millimeters. If you look on the internet, people will say that they love to do the 1.5 millimeter once every other week. Now, if you ever try the 1.5 millimeter, I will tell you it really hurts a lot. The reason is because I do it every day in my office and my patients are numb and I do it and it still hurts. So I recommend doing the 0.25, and we have these at Happy Ed. And so when you apply the topical Happy Ed on, you're gently gonna roll back and forth. The pressure should be the same pressure as you apply your deodorant. You should not make yourself bleed. Don't be in the same area for basically like 10 minutes. You really want to basically just keep moving it around left, right. There's really no magical formula. Just do it for about a minute or two, and that's it. How important is hydration in the whole process? Oh, I mean, it's important, but I don't think it's the most important thing. More important than that is trying to stay away from the bad things. So, for example, stay away from energy drinks, stay away from soy milk, stay away from anabolic steroids and creatine, and also all those pre and post workout shakes. Those are bad. Please stay away. If you want to do workout shake, we recommend whey protein concentrate, not the whey protein isolate. Would you be increasing the dose of the testosterone in the super capsule? That dosage, the 0.25, it is the standard of care dosage in the US for dutasteride. So there's actually not any hard dosage in the US. So if you want to buy dutasteride alone by itself, that's the dose you're going to get. So we're complying with basically the standard of care dosage formulas in the US, and that's why it's that dosage. I want to get off the oral medication entirely and switch to topical. Would this shock my hair? It's possible. Here's my recommendation. I would basically try to start the topical first, and once you kind of get into it, then you can slowly dial back on your oral medication. Do not stop your oral medication right away. You will have hair shock. Again, my opinion is that I think you should do both together, but if you want to stop it, kind of ease into the topical while you're still taking the oral, and then slowly taper off on your oral. What are the side effects of oral spironolactone? Spironolactone is a blood pressure medication that's used for adult hormonal acne in females, as well as the number one drug for female pattern hair loss in the US. The most common side effect is dizziness or lightheadedness, which is rare, but it could happen. It could also cause some breast tenderness, irregular periods, which means you might have more than one period a month or bleeding in between periods. Um, it could also increase potassium level, so please avoid bananas and coconut water and do not get pregnant on it. What should I do if I don't see results after 6 months? Reach out to us at Health and Happy Ed. My recommendation is that if you're on the standard formula of Happy Ed, we will switch you over to the one that has dutasteride in it, and we'll see how you do. If that doesn't help you in 3 months, then we should probably consider adding oral medications like oral minoxidil to your regimen. And again, you can also have a personal call with me, and we could customize your formula and your treatment plan. What medications would not mix well with these treatments? Well, if you're already on oral blood pressure medications, taking the super capsule may not be a good idea, so please run it by your doctor. For the most part, finasteride is really in their drug, and the interactions with any other drug is actually very minimal. Could ADHD medications increase hair loss? Typically not. Oh, guys, we're going to do one more question. If my happiest solution is starting to clump up and crystallize, does that mean it's expired? No, it doesn't mean that. The reason why it's crystallizing because as the weather gets colder, some of the minoxidil precipitates out of the solution and starts to crystallize. If that happens, let us know. We'll be more than happy to ship you another one. Typically, that may happen sometimes during transit. And again, it is pretty cold on the East Coast, and both of our distributors are located on the East Coast. If my happiest solution turned a darker yellow, is that okay? Yes, it is absolutely okay. There's nothing wrong with it. What's going on is that the aloe vera gets a little bit darker as time goes by, so that's not a big deal. Well, guys, thank you so much for joining us on another question. We answered 45 questions today. We should probably post this up. If there's any other questions, please make sure you reach out to us at Help at Happy Head. Also, please, if you take a moment and leave us a review on Trustpilot, we really appreciate it. If there's any other questions, let us know. I'm Dr. Ben Behnam, the founder. And again, thank you to Evelyn and Eric. Everyone's back basically from the holidays. Thank you so much, everybody. Have a nice day.